Hi, my name is Jones Muna. Today, we look at Introduction to Pharmacology. Definitions. 1. Pharmacology. It is the scientific study of drugs. 2. Pharmacist. This is a person who has studied drugs in great detail and is licensed to dispense drugs. 3. Dose. It is the amount of medicine to be given each time. This is always stated as a weight. All drugs are powder. They are measured by weighing them. In the metric system, drugs are weighed in grams, milligrams or micrograms. The powder may be pressed into a tablet, pill or capsule. The same weight of each drug is in each tablet. Each tablet contains so many milligrams. Sometimes the drug needs to be dissolved in fluid to be given by mouth or by injection. There would then be so many grams or milligrams in 1 milliliter of the medicine. It is therefore essential to say that the medicine is so many milligrams and not so many tablets. 4. Drug. This term is used interchangeably with medicine. 5. Special precautions. These are special things that the nurse must know or consider when giving a drug. Egg. Take the apical pulse. 6. Contraindications. These are conditions or diseases in which the drug should not be given because of the harmful effects it would have on the body. 7. Antidote. This is a drug given to correct or improve the harmful effects that a previous drug had on the body. 8. Resistance. This is opposition to or the ability to oppose anything. Bacteria have the power to resist the working of a drug. Therefore it is said that the bacteria are resistant to an antibiotic drug, for example to penicillin. Some terminologies used in pharmacology. 1a. General anesthetic drugs. These are the medicines that depress the cerebral function by inducing unconsciousness. They are usually administered intravenously and others through inhalation. B. Local anesthetic drugs are medicines that block the impulses of sensory nerve fibers, producing instant relief of pain on the area of administration but do not interfere with consciousness. They are usually administered through the intradermal or subcutaneous route. C. Intrathecal anesthetic drugs are the local anesthetic drugs injected into the spinal column, usually at the lumbar region, to block sensory impulses below the lumbar region. They are commonly used for major operation on the genital urinary system. They do not interfere with consciousness and are usually given together with major narcotic drug, for example morphine. 2. Diuretics are drugs that increase the reabsorption of water by the renal tubules, thereby increasing the solute and its excretion, resulting in the increased amount of urine. They are usually described or named according to action, e.g. I. The osmotic diuretics. These will increase the urinary output volume but will reduce the loss of sodium/salt. 2. The potassium-sparing diuretics. These are diuretic that reduce the loss of potassium but increase the loss of sodium, Na, and water, H2O. 3. Steroids. Anti-inflammatory steroids. These suppress all the inflammatory processes and also the generalized reaction of inflammation such as pyrexia and malaise. Therefore they should be used with caution because inflammation is the body's method of dealing with pathogenic bacterial inversion, and if the inflammation is suppressed the bacteria will spread to all parts of the body. Low immunity. As glucocorticoids, steroids are capable of stimulating the production of sugar from protease in the body, thereby reduce sensitivity to insulin. As mineraloids they cause retention of Na and water, leading to edema and development of hypertension. 4. Tranquilizers are drugs that calm patients whose overactivity, excitement or confusion are common feature. Types. I. Minor tranquilizers have a relaxing and tranquilizing effects in patients with anxiety, tension and fears. 2. Major tranquilizers are used in patients where a patient presents with severe symptom of anxiety, tension and especially where a state of confusion occurs. 5. Antidepressors, drugs used in the treatment of depression and illness that might occur as a result of unfortunate domestic and social condition. 6. Emetics and antiemetics. I. Emetics are drugs that provoke vomiting and are divided into 2 groups. A. Reflex emetics. These induce vomiting by irritating the stomach, for example warm salt. H2O, mustard 1 teaspoon to 1 pint of warm milk. B. Central emetics. These induce vomiting by irritating the vomiting center direct in the brain, for example apomorphine, no analgesic effect. 2. Antiemetics, drugs used to stop vomiting e.g. Plazil. 7. Antihistamine and histamine A, histamine, drugs that stimulate gastric secretion and cause vasodilation of capillaries and arterioles. B. Antihistamines, drugs that antagonize the action of histamines, and most of them have some antiemetic effects. Some antihistamine will cause drowsing. 8. Laxatives, purgatives and aperients, drugs which loosen the bowels, thereby promoting evacuation as a result of soft-formed stool, are commonly abused drugs in care, classified into 3 groups. I. Bulky purgatives, these include high-residue foodstuffs, for example mangoes. 2. Emollient purgatives, these usually include orals like liquid paraffin. 3. Irritant purgatives, for example castor oil. 9. Antifungal agents are drugs used in the treatment of fungal infections, and most of them are topically applied, but few of them are systemic drugs. 10. Antihelmintics are drugs used in the treatment of worm infestation. They are a diverse group of substances with widely differing properties. 11. Antimalarial drugs are drugs used in the treatment of malaria. They can be given orally, IM or 4. 12. Vaccines and antisera are drugs that give protection against certain communicable diseases. They are divided into 3 categories. Viz. I. Toxoid are given to bring about active immunity, and once given, the person produces antibodies against the bacteria or toxin. They are used mainly for prophylaxis measures. 2. Sera are preparations that are given in order to bring about passive immunity and are usually given for treatment, e.g. tetanus toxoid 0.5 ml sm. 3. Antigens are used for diagnostic purposes. 13. Antituberculosis drugs, anti-TB drugs, are drugs used in the treatment of TB. In general, there are basically divided into 2 phase viz., intensive and continuation phases.